So I would like to provide an overview, I guess, on the Millipede solution, and this is currently for mitral transcatheter annuloplasty. So if we look at the goal of surgical mitral valve repair, it's to restore leaflet coaptation, the zone of coaptation. And the surgeons have many methods to accomplish this, including leaflet reconstruction and annuloplasty ring. So an annuloplasty ring works by reducing the circumference and the anterior-posterior diameter of the mitral annulus, bringing the anterior and posterior leaflets closer together. And this is used in almost every patient who has mitral valve repair for degenerative disease. But it can also be used as standalone therapy in selected patients who have secondary or functional MR from ventricular dysfunction. So the concept was to mimic a surgical annuloplasty ring in that this would be a complete ring that's fairly rigid, that it could be customizable, repositionable, and retrievable, and that it would be placed easily using conventional imaging techniques. And I'm going to show you how we have accomplished that using an integrated ICE or intracardiac echo catheter. This procedure is done entirely through transfemoral transeptal access like a MitraClip, and remove the sheath at the end and perclose the groin. So the three steps are, number one, we steer the device down towards the mitral annulus. It's opened and anchored to the mitral annulus, and it's actuated to perform annuloplasty. Now, in terms of a solution, this is a solution that is a surgical gold standard. How we're going to apply it specifically in the transcatheter realm is something that, of course, we're going to have to investigate and prove. In terms of the challenges of this technique, the reason why there are not a lot of these devices floating around is that the real challenge is how do you anchor precisely to the mitral annulus the way a surgeon would. So I'll talk about that challenge here in our solution. So this is the delivery system. So at the top we see there's a guide catheter which has a control knob to allow deflection. There's a delivery catheter that's also deflectable that goes inside the guide catheter, and the Millipede device is anchored here. And then inside all of it is the integrated ICE catheter. So here's a video. The video shows the device being brought transeptal, can be expanded, and really you see this light blue catheter in the center. This is the integrated ICE catheter, which from the inside of the device can spin around and see each anchor and each hinge point individually to allow precise anchoring, and you can adjust each anchor. So there's an anchoring sequence, and then once that's anchored, we actuate the device. If at any point you don't like it, you can actually take all the anchors out, you can collapse the device, remove it completely from the body. So it's completely retrievable up until the point you decide you're going to deploy it, and this is showing deployment. When it's deployed, the device is completely circumferential around the mitral valve. So here's an example patient. This is a patient that might have been enrolled, say, in the COAP trial, 30% EF, functional MR, symptomatic on guideline-directed medical therapy. Patient had also received a CRT device, but despite that had persistent functional MR that was symptomatic that you see here. So all the patients in our current series have undergone CT pre-screening. This is probably most useful to define the relationship to circumflex. We've talked about that in terms of the right coronary. We also want to be very cognizant of where the circumflex is for mitral annuloplasty. So with careful planning, we've not had any cases where we've had any damage to the circumflex. This shows the catheter being steered down to the valve. And then really, at this point is the challenge session, which is that we want to know where we're going to put the ICE catheter. So we've developed a method where we can look at each quadrant or sector of the mitral valve like a clock face, and each section, and we have a paper in press that will describe this in detail, has a very characteristic ICE view. And by using that ICE view, we can know exactly where on the clock face each anchor is and where we're going to deploy it. So you see fluoroscopically here, we have the device and the anchors. But here on the left panel using ICE, you can see the anchor in relation to the mitral annulus and how it's being deployed actively under direct vision. So we can see directly the angle and the depth and the location of the anchor. This is the final view after release. And in this particular patient, we have follow-up echo here at 30 days. You can see essentially with trace to 1+ MR. So this is a summary of that case. Total procedure time was 91 minutes. In the last 3 to 4 cases we did, the actual device time was about an hour. So this is something that is reproducible, and this has been published in the Structural Heart Journal, and you can look this article up in September 2017 on the whole procedure. Where do we stand today? We have done 15 patients as part of the early feasibility trial with integrated ICE. All these patients were done in South America. We were able to show we could deliver device in all 15 patients. There were no procedural deaths, strokes, or MIs. All patients were discharged from the hospital alive. Procedure times were and delivery times were about 60 to 100 minutes in the last 8 cases. And we were able to show significant reduction in MR and AP diameter. Now, as many of you may know, the company has now been acquired by Boston Scientific, and so this is being integrated into their structural heart program. And of course, additional studies and clinical trials are being planned within that framework. So in summary, we have Millipede, which is a complete semi-rigid annuloplasty ring designed to replicate surgical repair. It is repositionable, retrievable, and very customizable in terms of the degree of actuation. We use ICE, which I think is really the disruptive aspect of how we do this procedure, and it is transfemoral and transseptal. Thank you very much.